Welcome to our first edition of Timeless Voices of Wisdom, the channel where stories live forever and every voice carries a lesson. This morning we are privileged to have a great man with us, not only embodies service, vision, but also is a pioneer of private healthcare in Ghana. We are honored to have with us Dr. Horatio Atom Beecham, great pioneer of private healthcare with over 40 years of service in the Ghana medical space and a hero in the community of Dansoman, serving the community for more than 40 years. Dr. Beecham, you are welcome to this channel.
Thank you very much for inviting me.
Thank you for also accepting to come for this interview. To break the ice, we would want to know what is the food that you would not forgo on any day. What type of food would you not forgo on any day?
I will always go for Ghana jollof.
Why Ghana jollof and not any other jollof?
And Ghana jollof cooked with turkey meat, not chicken.
Wow. Is there any reason for the choice?
I just love it.
Wow. Wow.
And I prefer it together with succulent kalewele.
I see.
They go very well together.
I see. Succulent kalewele. Wow. Kalewele for Omosempa. Oh, okay. So, doctor, in terms of music, what is your choice of music? What type of music would let you get up and do your own thing? Given a chance?
I like all sorts of music.
Okay.
But my favorite is Sweet Mother.
Okay.
By the Nigerian musician called Tony Mbage.
Okay.
He immortalized that song.
Okay.
And he makes me remember my mommy.
Oh, I
so
see.
Much.
Oh, I see. I see. Wow. It means your mommy
She was a great mother,
okay.
Very loving, very caring, and very dependable.
I see. I see. So, can you tell us a little bit about your childhood since your mother has come into the picture?
Oh, my parents moved from the coast and migrated to Ashanti region, seeking greener pastures, and settled in Kumasi.
Okay.
My father started working as an accounts clerk with the KPHB, the Kumasi Public Health Board,
okay.
in the early 20s. My mother was a full-time housewife. It was in Kumasi that I was born, and I'm in my 91st year of life.
Wow, 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 wow. 91-year-old. Well, Doc, you're looking very strong.
By the grace of God.
Viewers, so Doc here is 91-year-old and still going strong. And I'm sure we'll be here for a very long time so we can get a few more nuggets of wisdom from him. Doc, good to hear all that. What were your greatest motivations as a growing child? Or who do you have a particular person who motivated you whilst growing up into a young man and eventually moving on into career?
Unfortunately, I cannot recollect any incident or any particular incident that drew my attention as I went along. Things just gelled together as I moved.
Okay.
And I ended up where I am now.
Wow, 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 wow. I hear you went to Achimota School.
Yes, I did.
Okay, in which year did you go, and what were some of the funny or...
I went to Achimota School in 1949. I sat the Achimota School entrance exam in 1948. This was the last examination that was conducted by Achimota School to select pupils for the school.
Okay.
The common entrance examinations were started the following year, okay. So I just missed it. Being one of Methodist parents, my parents had wanted me to go to Mfantsipim, especially my big brother had been there before, and my maternal grandmother, who lived in Cape Coast, apparently had contributed 2 shillings towards the building of Mpantepem, the when they moved to Kwaboche. So she wanted me to go and spend the money that she had.
Interesting.
Fortunately or unfortunately, that particular year, one had to apply for Mpantepem exams with a self-addressed envelope with, I think, 6 pence stamp on it. And I put in a self-addressed envelope with 3 pence stamp. So they didn't mind me. And it was a good thing they didn't mind me. So I was left with only Achimota.
Okay.
I went and took the exam. Unfortunately, I was accepted.
Okay. Okay. That's good to hear. Any fond memories from Achimota?
Oh, yes. It was a great place.
Okay.
It's a really great place. A very big school, very well endowed, good teaching, good food, and there was discipline.
Okay.
Yeah.
I see. Any names you can recollect from Achimota?
Any what?
Any names you can recollect from Achimota?
Ooh, I remember most of the names. Yes,
Wow.
the headmaster,
Okay.
Peter Renner, Kofi Atubam,
Okay.
all of them, all the old people. Achimota.
I see. I see. Okay, Doc, that's good to hear. Achimotans, there you have one of your great men right here before me. Great to be interviewing such a great man. Doc, let's move into career. What was it like studying medicine abroad? Or did you start here and go to abroad? What was it like?
Well, I
How
did
did you
my
all start?
ordinary levels and then went into the zoology botany class in the sixth form. After that, fortunately, Sergeant Dr. Kwame Nkrumah has started Africanizing the various facilities that they had, and we're trying to get Ghanaian doctors trained. And we applied, and I was accepted.
So it wasn't something like, I remember when we were kids, they would ask you, what do you want to be in future? I would want to be a doctor. I want to be a soldier. I want to be a pilot. Was it something like that for you?
No, it wasn't. It wasn't at all.
Okay.
I just somehow, as I said earlier, things just gelled and pushed me along. And I had the opportunity, and I accepted it.
How did you then end up there? How was life there abroad? And then eventually you moved from abroad and came to Ghana. Can you give us a brief narrative about moving to abroad and then coming down to Ghana?
Yes. At that time, there was no medical school in Ghana.
Okay.
So you had to go abroad. And in fact, my set was the last group that was sent abroad by the government. The following year, all those who were selected were sent to Nigeria.
Oh,
yes.
I see. And how many years did you spend abroad?
I went there in 57 and then came back in January 64.
Okay.
Having graduated in 62 and having done my internship over there.
Okay. My brief information about you says that you helped model the Ghana Medical School. How was it like?
Well, when I came home, I worked with the surgeons, namely Professor Ismon, Professor Bedu, and Dr. Dansoman,
Okay.
who later on became the Vice Chancellor of KNUST. And they really put me through the ropes. It was at that time that they had just started the basic sciences department at Kolebu, and they wanted people to help. So they offered me a place there to go and help as a demonstrator in anatomy, because I was planning to go back and do surgery.
Okay. Why would you want to leave Mother Ghana and go back? Was there something special pulling you back there?
No, for postgraduate training, there was no facility here.
Okay.
So we had to go back.
Okay. I presume you eventually went back.
Yes, I went to Canada.
Okay.
To do my postgraduate studies in surgery. And I'm happy to say that within 1 month of completing my course, I was on my way back home.
Wow. Wow.
And I haven't regretted having come.
Oh, wow, 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 wow. That's good, good. Cheers, 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 Odo. Cheers, 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 cheers. So, viewers, here we have a great man, trained, went abroad, did surgery, came back to help with Kolebu, went back for his postgraduate, and didn't stay back there, but rather came home to help. And like he's saying, he hasn't regretted it so far. And I'm sure no regret. Or is there something that makes you regret?
Not at all.
Great, 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 great to hear that. I'm here interviewing you mainly because, for one, I remember as a child, if they talked about hospital or clinic, for me living in Dansoman, it was only one place, Dr. Beecham. As I grew up, I later got to know the name is Central Dansoman Clinic. But to all in the community, it was Dr. Beecham. How did that dream come about? And how did you manage the whole thing? Because for me, I think that was something very innovative.
I didn't know. I think I was very lucky because Dansoman was a developing community. There were no facilities for medical services here. And I happened to be the first one to come, so I literally grabbed everything that was around. So that made me popular among the people over here. And things just settled out that way.
At that time, I'm sure it was one of the first medical establishments in the community, if not the first.
It was the first.
Wow, wow, wow. And what was the challenge? How was the challenge? And how was it building, getting staff, putting the whole plan into action?
It was done in bits. I lived in part of the building and I used the other part as a clinic. In fact, I divided my living room into two portions. A smaller portion, waiting room, a consulting room, and a bigger portion, waiting room. I used my study as the theater where I did minor surgery. It was a very small establishment, and with time it grew until I was able to develop a residential place next door. And then I opened it up using the whole of the original building for the clinic.
Look, as a child, if my mind serves me right, I think one of the most amazing things for me was seeing the numbers of people coming to your clinic at that time and seeing the diverse nature of the people who were coming. Because as a child, I was seeing people coming all the way from Kasua and even beyond. At that time, Kasua and Dansoman were miles apart because development had not happened that much. But I saw all those people coming in. What do you think was really bringing them? Because I was really amazed, even as I grew up. I realized that, hey, these guys are coming from GBC behind Kasua and beyond. And I'm like, why would they leave Kasua and come all the way to Dansoman to see Dr. Beecham?
Perhaps they like the way I worked.
Okay.
I had a lot of respect for my patients. I gave them the sort of treatment that they required. We became friends. Some became very good neighbors, and so on. And they just spread the news that if you come over here, you are received very amicably, and your problems will be solved. So the clinic just grew.
Wow, wow. I would say that is very true because I, as a kid, also attended Central Dansoman Clinic. Growing up, I still came to Central Dansoman Clinic. Having children, I brought them to Central Dansoman Clinic until eventually you retired and then handed the business over. I'm looking at one of the most important career moments in your life. What can you tell me about one of the most important career moments, and then how did it make you feel, or was this something that catapulted you into another area? What would like to know?
This was when I was elected to serve in the Ghana Medical and Dental Council as a member. I was there for 5 years initially, and the next 5 years I was elected to be the chairman, responsible for overseeing the running of the place. And I remember on several occasions being responsible for swearing in the newly qualified doctors at the various locations, both in Accra and Kumasi.
Wow, wow. So how were you able to balance your clinical life practice with governance?
Oh, it wasn't difficult. You worked during the day, morning, early afternoon, and in the evening, in the later afternoon, you went over to the offices and conducted your business. We didn't have meetings every day. We had meetings, I think, once every month, and then you had to go and check what was happening at the office yourself without the other members.
Wow. Wasn't that stressful?
Pardon?
Wasn't that stressful?
No, it wasn't at all.
Oh, I see.
We had a registrar who was very efficient, and
Okay.
he did most of the work, and I carried me along.
Do you remember his name?
Yes,
Oh,
Dr. Duaye.
okay, okay. Dr. Edua, wherever you are, we thank you for your meticulous
Unfortunately,
words.
he's gone.
Oh, okay, okay. Information reaching me indicates that you are one of the pioneers of private insurance in Ghana. How was it like, and how did it happen?
I was elected to work with a committee that used to vet uh, claims by providers of the national health, the private health insurance scheme.
Okay.
Initially with erstwhile Metropolitan Insurance.
Okay.
Later on, I worked as the representative of the providers of private medical uh, care on the board of GLICO.
And how has the journey been like from the inception of the private healthcare insurance up till now? How do you see it, and what do you think can be done about any?
I think it's improving. It had its difficulties. Things are straightening themselves out. I'm no more with them, so I'm not up to date. So I cannot write so that.
Uh-huh. Doc, what necessitated the institution of private healthcare insurance? I feel that people at that time, people were, if my mind serves me right, you go to the hospital, you are charged, you take money from your pocket, and you pay. Was it creating problems? How was the private healthcare insurance able to mitigate some of these problems?
Well, it's private healthcare insurance is just like any other insurance. You pool resources, and then you share the benefits. Um, if you're going to wait until you need a large sum of money for a particular ailment, you may not be able to afford it. But if you have to pay small quantities over the year with lots of people, you pull together you are not all going to be sick that particular year. Then you can use the money to look after those who need it. So it's a very good idea, actually.
I believe so too, because if you have not had the benefit of actually using private health insurance for any emergency medical procedure, then you wouldn't know what Doc is talking about. That I have been a beneficiary of private medical insurance, and I know what Doc is talking about. Okay, so Doc, let's divert a bit into general family life. Can you tell us a little bit about your family life?
I had 3 brothers and 2 sisters on my mother's side.
Okay.
My father had other children.
Okay.
And we were all numbered, I think, 14.
Wow. That's quite a number.
Unfortunately, they're all gone, apart from 3 of my mother's children and 1 of my half siblings.
Okay. Viewers, welcome back to the Timeless Voices of Wisdom channel. Like, share, and subscribe if you haven't done so. So, Doc, what I would want to know is there any lessons that you have learned so far in your many decades of work? Were there any challenges that you met, and how were you able to surmount those challenges, if any?
Yes. In the first part of the 70s, life was tough, economically, socially. Working facilities were very difficult to acquire. Working in a place like Kolebu, one depended a lot on other facilities, other departments, who were also finding it difficult to provide the sort of service you required. There were shortages in equipment, in medical products, even water. You could be in the theater, the lights would go off, the air conditioner,
Ventilation.
yes, will go off, and it was very, very difficult. I decided that perhaps if I could get out and plan things my own way, I would know how much I could carry and how much to go for. You should have focus, knowing what you want, and go and get it. And if you come and you work hard at it, you will make it. So I left.
That must have been a very hard decision to take.
Initially, it was very difficult to convince myself that I was going to be able to make it. But I came along, and the first month, business started booming, and it went on till I left.
Wow.
After about 40 years.
Wow. 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 Well, as young men who are coming up, most of us are not able to branch out because of the fear of failure. Didn't you fear you were going to fail?
I did, but conditions at that time in the public service were expellent. They pushed you out, and you had to survive. That's why I said one should have focus. One must know what one wants and go for it.
So right now, if let's say a younger Dr. Beecham, or should I say a younger Beecham, were to be sitting here and you were to be advising him, what would you tell him?
It depends. If he or she is working in an atmosphere of where there's some satisfaction and the facilities are adequate and so on, I would rather advise the person to stay where the person is trying to come from. But if one is not happy facilities are not available, and you stay there, I think it's better to work out and try and make it on your own.
So, if you were to be given the chance to speak to young men or young professionals in Ghana today, not just doctors but anyone, what advice would you give them?
My advice would be, as I said, for them to know what they want in life, have focus and plan, and get on with it. It's not easy. They should realize it's not going to be easy. It's going to be hard work. And if they go with that sort of attitude, they will succeed.
Great. So, guys, there you have it, the advice from the 91-year-old Dr. Beecham. That's not coming from me. I'm just a little less nowhere near where he's gotten to in life, and then as a prominent Ghanaian surgeon, medical doctor, dentist, pioneer of private health institution in Ghana, pioneer of private health insurance. I'm nowhere near him. Doc, before my final question to you, if people are to remember Dr. Beecham, what would you want to be remembered by?
I would like them to remember me as a very straightforward, very sincere, friendly, and hardworking person.
So, viewers, I think I concur with what the doctor said. I have been an active patient of the Beecham for years. In fact, from what I could remember, it was from infancy right up to growing up and also giving birth and even bringing my children to him for healthcare. And so I concur, and I'm sure viewers across the world who have passed through the Central Dansoman Clinic would also attest to the fact that doctor is not just any ordinary doctor, but a doctor who is loving, who is amazing, who knows how to treat people well, who makes healthcare accessible to the less privileged, and the list goes on and on and on. Doc, finally, if you have one message to give to Ghana and to Africa as a whole, and let me say to the world, what would be your message?
I think we should live our lives in such a way that we leave the world a better place than we found it.
Okay. Leave the world a better place than we found it. Viewers, this is a word from our own Dr. Horatio Atom Beecham, fondly called Dr. Beecham by one and all, children and elderly alike, the hero of the Dansoman community. If you come to Dansoman and you don't know of Dr. Beecham and you don't know of the street named Dr. Beecham, then you have not been to Dansoman, guys. Doctor, it's been amazing talking to you. I've learned a thing or two, and I'm sure viewers will take nuggets of wisdom from our little conversation. Viewers, this has been Timeless Voices of Wisdom, and we have taken a few nuggets of wisdom from Doctor, and I'm sure with what we have heard, we'll keep a few things in our pockets that will take us on as we edge on through this hard and difficult life. But like he said, all is not lost. With hard work, determination, and the zeal to leave the world a better place than we came to meet it, we can all make it. Thank you, one. Thank you all. And I would want to say, if you have not subscribed to this channel, subscribe, like, comment, and share, and we'll get right back to you. Thank you, one and all. Thank you very much for listening to us. And thank you, Doc,
Thank you very
for
much.
honoring my invitation.
Thank you very much.
Thank you too.